Welcome to The Explainer. I am so thrilled to have you here today because, look, we're looking at a massive fundamental paradigm shift. It is currently transforming the entire healthcare industry right beneath our feet. Today, we're going to deconstruct the future of healthcare, and the changes we're about to explore, they are going to affect every single one of us, mostly because they're being driven by this massive explosion in artificial intelligence and connected data. Just think about the stark contrast we're witnessing right now. We are moving from the harsh, historical realities of communal quarantine all the way to receiving true hospital-level care while literally sitting on your very own couch. Healthcare is undergoing this profound transformation. It's pivoting away from simply reacting to your illness to actually predicting it before it even happens.
So let's dive right into part one, past to predictive care. If we look back, our healthcare journey is marked by these massive leaps, right? The foundation was built on early public health, which was literally just trying to contain disease through quarantine. Then, by the mid-20th century, vaccines and antibiotics triggered this dramatic jump in life expectancy. Recent decades accelerated that with genomics and, of course, incredible mRNA treatments. But today is a completely different ballgame. We're entering an era where AI isn't just a background tool, it's an active participant in clinical decision-making. For centuries, medicine has been, well, purely reactive. You feel sick, you go to a doctor, and they try to fix the damage, right? The new model flips the script completely. By actively predicting illness based on your unique data trends, we can actually stop a disease before it ever takes hold. It's a huge move toward long-term well-being and proactive prevention, and it's entirely redefining what it means to practice medicine. Which brings us to part two, the connected living room. So how does this actually look for you and me? Modern healthcare systems are becoming incredibly proactive. Through continuous remote monitoring connected devices, the ones on your wrist or set up around your home, they track your vital signs in real time. Imagine the absolute peace of mind knowing your health is being optimized continuously without you ever having to step foot in a waiting room or a clinic. Okay, but how does this actually work in practice? It's basically a seamless three-step predictive workflow. First, your wearables track a continuous stream of your vitals. Second, AI-powered diagnostics instantly process that absolute mountain of data, finding subtle, microscopic patterns that a human eye might easily miss. And third, healthcare professionals use those AI insights to immediately prioritize the urgent cases. So AI steps in as an active, absolutely essential part of patient care. Now, you might be thinking, if patient care is moving into the home, what happens to the actual hospitals? Well, they're upgrading too. Automation and robotics are completely transforming how hospitals operate. We're talking sanitation robotics, ensuring pristine environments, logistics support, moving vital supplies seamlessly across floors, and the automation of all those repetitive administrative tasks. This drastically improves overall efficiency and, here's the best part, it allows the medical staff to focus on what they do best, providing that complex, highly empathetic patient care that a machine simply cannot replicate. All right, let's move on to part three, pressures driving the pivot. Because we do have to face a pretty sobering reality here. Why is this massive shift happening right now? Globally, populations are aging rapidly, and that comes with a massive spike in chronic diseases. Our traditional, reactive hospitals, they simply cannot handle the sheer volume of patients anymore. This immense demographic and economic strain is the core reason healthcare is quite literally being forced to evolve just to survive. And to survive that strain, the physical delivery of care is decentralizing. The heavy load is shifting away from those massive traditional hospitals and moving toward nimble outpatient care centers and highly scalable digital-first health services. And the glue holding this entire ecosystem together? It's a newly integrated digital infrastructure. We're talking secure digital IDs and universally connected health records. Let's zoom out a bit for part four, reshaping global healthcare. Actually, scratch that. I want to pause here for a second because this definition is absolutely crucial to understand. Value-based care. For a really long time, the healthcare system financially rewarded the sheer volume of services provided. Basically, the more tests run, the more money made. But value-based care, it flips that entirely. It emphasizes and rewards actual patient outcomes and long-term well-being. So the financial incentives are finally shifting to prioritize your actual health rather than just the number of treatments you receive. It's a real game changer. When we pull back and look at these global trends altogether, a really beautiful picture starts to emerge.
Administrative automation is reducing clinic burnout. AI is accelerating medical innovation at warp speed. But the ultimate victory of all this technology is distinctly human. By removing all that operational busywork, doctors and nurses are finally empowered to return to deeply personalized human-centered care. But before we celebrate, we need to talk about part 5, the digital danger. Because we have to ask ourselves a very critical question. As we digitize our most sensitive, life-saving data and connect every single device in our homes to these medical networks, what exactly are we exposing ourselves to? The source material puts this perfectly. Listen to this. Growing digital dependence introduces new risks, with cybersecurity threats such as ransomware becoming one of the most serious challenges to healthcare systems and patient safety. And that is the stark reality of this situation. As care becomes more connected and intelligent, it simultaneously becomes a massive, massive target. A cyber attack on a hospital isn't just an IT problem anymore. It is quite literally a life or death patient safety issue. So we're basically left balancing this profound dual reality. On one hand, the opportunities are undeniably massive. Earlier interventions that save lives, smarter diagnostics, deeply empowered patients. But on the exact other side of the scale, our growing digital dependence invites severe cybersecurity threats and patient safety risks that previous generations of medicine literally never had to face. I want to leave you with one final, provocative thought today. Healthcare is clearly moving toward a future that is more connected, intelligent, and patient-centered than ever before in human history. But as AI becomes an active clinical decision maker sitting right there in your living room, you have to ask yourself, is the incredible convenience and life-saving potential of connected, predictive care actually worth the cybersecurity risks to your most personal health data? Thank you so much for joining me to deconstruct this fascinating topic today. Keep learning, keep asking questions, and I'll catch you in the next explainer.